as many as 20 million Americans could see their premiums skyrocket, paying thousands more for healthcare or losing their coverage entirely. New Yorkers from every corner of our state will suffer if these cost increases become a reality. A single adult making $65,000 a year in Tompkins County will see their premiums increase from about $194 a month to over $800 a month. A family of four making $130,000 in Suffolk County will see their premiums increase by over $700 a month. Good morning, everyone. Thank you for joining us. As you know, last week, President Trump and congressional Republicans shut down the government rather than work with Democrats to make Americans' health care more affordable. Americans are already struggling with rising costs. Everything from groceries to clothing to utility bills are now more than they were 8 years ago, and working families are feeling the pinch. But instead of working to lower costs and help families that need support, President Trump and his administration and the Republicans in Congress are doubling down. Thanks to Republicans' inaction, millions of low and middle income Americans are facing a looming healthcare affordability crisis. With enhanced Affordable Care Act subsidies set to expire, as many as 20 million Americans could see their premiums skyrocket, paying thousands more for healthcare or losing their coverage entirely. New Yorkers from every corner of our state will suffer if these cost increases become a reality. Today, my office is releasing a detailed county-by-county analysis of expected premium increases if President Trump and the Republicans refuse to extend these subsidies. New Yorkers can access this report at gillibrand.senate.gov/Trump healthcare increase. Let me give you just a few examples. A single adult making $65,000 a year in Tompkins County will see their premiums increase from about $194 a month to over $800 a month. A family of four making $130,000 in Suffolk County will see their premiums increase by over $700 a month. A couple making $90,000 a year in Herkimer County in the Mohawk Valley will see their premiums increase by over $1,300 per month, rising from about $150 to over $1,500. That is a 900% increase, all because Republicans refuse to extend these healthcare investments. All of these figures are based on the cheapest insurance possible in New York. For New Yorkers whose healthcare needs are more substantial or who want more comprehensive plans, the difference could be even higher. And for those with the option to get healthcare insurance through their employer, even those costs are set to soar next year. Most Americans don't have hundreds of dollars to spare every month to cover these cost increases. That means these premium hikes will force some New Yorkers to go without insurance, taking the gamble that they won't fall sick or encounter a medical emergency. In some cases, this could be the difference between life and death. One New Yorker, Maddie, told me that she's extremely worried about how these increased premiums will impact her. Maddie is self-employed and she relies on ACA tax credits to offset the rising cost of insurance plans offered through the marketplace. She told me that without these tax credits, she may have to ration her medicine or forego doctor's visits to save money. This is absolutely unacceptable, but unfortunately, Maddie is not alone. Her story is just one example of a Republican-manufactured health care crisis that is driving up the cost and terrifying Americans across the country. That's why I'm calling on my Republican colleagues to end the gridlock and work with Democrats to make healthcare more affordable. These tax credits need to be extended now because the premium rates must be locked in before open enrollment season begins on November 1st. Democrats are ready to negotiate, but while Republicans are refusing to come to the table, their constituents are scared about their health care. I'm committed to working on a bipartisan deal to protect our families from higher health care costs and to end this shutdown. We have to get this done. Any questions?
Senator, hi, it's Ron Plants from WGRZ in Buffalo. Are you hearing anything at all about some layoffs now or furloughs possibly occurring with IRS employees. We're just starting to get some notice that apparently they have been put on warning that this will be happening perhaps later today. Are you hearing anything and about that? And what would you suggest to these people, obviously in light of the White House yesterday with talk about them perhaps not being compensated? We don't know about the IRS, but certain federal workers may not be compensated.
Well, we've heard that President Trump wants to fire a lot of federal workers and he doesn't want to pay the workers who are being furloughed. Both of those statements are illegal and wrong. He is not allowed to do either of those during a shutdown. Have we heard anything specific about IRS employees?
Employees, but he says completely illegal. Congress has to know this was going to sound illegal.
Yeah. So in 2019, we actually passed a law that guarantees these employees get their back pay. Even President Trump signed that into law. So this is illegal. He's not allowed to do this, and we will file lawsuit after lawsuit to make sure workers get the pay that is theirs.
Hi, this is David Olson from Newsday. I've talked before with Republicans here on Long Island about the enhanced subsidies expiring. Their argument is they were meant to be temporary. They're never meant to be permanent. What's your response to that?
Well, as you've seen, the cost that these insurance companies now want to charge is unaffordable. So they're unwilling to make sure Americans can get affordable insurance. So just because these insurers want to raise their rates to an unaffordable level, we should make sure that people can still afford it. And that's what the subsidies do.
Since nobody else is coming in here, I'll throw in another question.
Yep.
Just in general, what are you hearing about negotiations? I asked one of your Republican counterparts, Nick Langworthy, yesterday, is there anything going on back channel? You know, maybe not formal negotiations, senators, representatives at least talking to each other across the aisle, trying to figure out. I think you alluded to the fact that you're trying to work on a bipartisan solution, but is there anything really happening, or is this just a wall between you at this point?
Right now, President Trump has told House Republicans not to negotiate. And it doesn't matter if Republicans and Democrats are talking in the Senate about possible ideas because the House is unwilling to act unless Trump allows them to. So we are in a standstill because of President Trump. There's lots of bipartisan discussions happening in the Senate about reasonable ways forward, but none of them matter because the House is unwilling to act because of President Trump.
To follow on that, we asked a couple of weeks ago when, again, Mr. Langworthy was here, Representative Langworthy, the feeling of the public on this, as you're probably well aware, a lot of people, frankly, while you are saying that's their fault and they are saying it's your fault, the American public is probably going to say it's all of your faults. Do you worry about recrimination with upcoming elections, and also just the attitude of the American public that this is getting more painful? They're worried about the airports. They're worried about various things. So do you fear that this could have long-term ramifications for both parties and the incumbents in office? Because some people would say, quite frankly, you're not doing your jobs. You didn't get this done. You didn't figure it out.
I think Democrats are using the only bit of leverage we have right now just to fight for people's health care. I think the raise in rates is so untenable and so frightening to so many people, along with all the planned cuts to Medicaid funding, in addition to all the research for health care through the NIH that's been canceled. People are terrified, and health care is life or death. And so it's probably the most important issue to most people. And so Democrats have stood and are standing strong to say, we only have this very small amount of power. President Trump controls the White House, the House, and the Senate. And so we are trying very hard to take a stand now on healthcare because we want to stand with the American people who will not be able to afford it and are terrified.
Senator, this is Billy House with Newsday. Let me piggyback on that a little bit. You've taken the job of being the leader of the Senate campaign arm, Senate Democratic campaign arm. How has this made your job more difficult, if it has, combined with the party fracturing over the mayoral candidacy of Mr. Mondami? Are these headaches you didn't anticipate, and are they pluses or minuses? Certainly, Mondami seems like a minus in your efforts to help recapture the majority.
Mm-hmm. Well, I don't think a New York City municipal election affects elections around the country, so I'm not as concerned about that. But I am very concerned that President Trump is standing between people and their health care. And I think it's a vital issue that Democrats must fight for. And so at the end of the day, people will see what Democrats are for through this fight, that we believe healthcare should be available and affordable to all people, period. And to make sure our constituents aren't without healthcare. So I think it is a right fight. I think it clarifies for people who we're fighting for and what we're fighting for. And I think that's a meaningful conversation to have in the entire country.
Thank you.
Hi, Senator. This is Nolan Hyman with WKTV in Utica. You mentioned negotiations between Democrats and Republicans. When it comes to the Affordable Care Act, what would those negotiations look like? Is it going to be taking some of what Democrats want and then forging a plan with Republicans? How is that going to look?
Well, we're hoping for any movement towards covering people's health care. And we've laid out a whole host of ideas about how to do that, restoring the Medicaid cuts, making the subsidies permanent. We've offered multiple ideas about how to do this, but what we're standing for is affordable health care. And we're open to discussions on anything with regard to making healthcare more affordable, and we've given them multiple ideas about how to do it.
Thank you.
Senator Terry.
Go ahead, Terry.
Yeah, thank you. I did want to ask, you gave some county by county rundowns of what kind of impact these increased premiums could have. Did you have any figures for Chautauqua County?
I do, and I'm just looking it up right now. Chautauqua County, it's the current, I really could use my glasses. Can you go get my glasses from my desk? So Chautauqua County, it's 2025 monthly cost is $329. And then 2026 monthly cost is $433. Additional monthly cost of $104.30. Additional annual cost of $1,251. It's a 31.66% increase.
Thank you.
And we will circulate this chart to everybody on the call. And that was for a single individual making $65,000 a year. For, let me just, if I can do this, for a family of four making $130,000, it would be a 20.73% increase. So it would go up from, it would go up an annual cost increase. There we go. Let's see, Chautauqua. An annual cost, additional annual cost increase of $2,547 for a family of four making $130,000.
All right, thank you.
Anyone else need numbers?
Senator, can you just tell us where you're getting those figures from?
Yes. Calculated from the New York State Department of Health website. State of New York, it's on nystateofhealth.ny.gov. And there's a calculator.
Okay, but obviously sometimes we hear from Republicans questioning the sources. Obviously, you're saying that's New York State Department of Health.
Yeah.
Some people feel that's a very politicized organization, to be completely honest, under Governor Hochul.
Yeah, there's no evidence that it's politicized. This is just data.
Right, but is anything from the Congressional Budget Office or anything? Because this is just coming from the
Yeah,
state.
done it yet. Yeah, so CBO won't do this because this is a county by county breakdown. So only the state has the information about not only the New York marketplace, but county by county figures. Sorry, say it again. Yeah, because each state runs their own exchange. So we are the only ones who know the actual published costs of this exchange at this moment in time. So it's all publicly available information, so you can check it yourself.
Okay, I'll let you go. Yeah, to be honest, some people have questioned things coming out of Albany with figures.
Well,
That's
you
all I'm
could
saying.
go to the exchange yourself. So if you go to the exchange, do you have healthcare in New York?
I
So
do
if you-
not personally, but
So you could just check with somebody you know, a loved one, and ask them to just go to their exchange and type in, what they're buying, and they'll see. Like we've done screenshots of lots of individuals, just the rates they're being given by their insurer today. Yeah, the notices are now being received, so you can also ask any person on the street, did you get a notice? What does your notice say? So you can verify this stuff if you want. Yeah, and these rates unfortunately get locked in on November 1st. Yeah, I mean, the percentages are massive. Like in Tompkins County, it's a 313% increase for a 65,000 a year individual. Let's see, Otsego County is a 290% increase. I mean, these are huge numbers.
Senator, let me throw one other thing at you, and I apologize. I'm not trying to monopolize this if anybody else has questions, but we appreciate your availability.
Yeah.
Also, we asked Representative Langworthy a few weeks ago, in essence, do you think you should be collecting your paycheck, your $174,000 paycheck, while this is unresolved and why we are seeing some federal employees being furloughed because of this dispute between the parties?
Yeah. And what did he say?
He said he'd be willing to withhold it. We'll check obviously to make sure.
Yeah.
But what do you think of that?
Yeah.
Again, just with the anger of the American public, the frustration, not just with you, but Congress in general and the White House, just the frustration that you're getting paid, but a lot of other employees, including those in the military, are not.
I think it's appropriate for members of Congress to have their pay withheld during these shutdowns, because then they can actually understand the challenges, the fears, the anxieties that the American people are facing, who may be federal workers, may work at the VA, may work at Social Security Administration, maybe air traffic controllers. And I think they should share in that anxiety. So I've already announced that I'm having my pay withheld.
Thank you.
Senator, this is Billy House one last time. Are you hearing anything from your centrist friends about a more concrete grouping or effort to propose a compromise to get this resolved?
So several of the senators were working in a bipartisan working group over the last several days, and that did not end with a proposal by Republicans of what they might be willing to do. Their end point was open the government and then we can talk about it, which isn't good.
Okay, thank you.
Senator Connor Fraudoff of WNY out of Elmira and Corning has at any point during these discussions, of course, with funding being the main issue, has at any point Democrats been willing to point out that the White House was very willing to send a $20 billion bailout package to Argentina and their economy? Meanwhile, the United States in this shutdown with federal workers likely to lose jobs and people likely to lose health care. Has that been brought up in conversation to say, hey, we're trying to work with you, but you're willing to send money out of the country while our government is inoperable?
Right. It's an obscene fact. And the real problem we have right now is that President Trump is doubling down on his disregard for federal workers, not only saying he'd like to fire them, but they shouldn't get paid at all. And then also taking aim at Democratic states, blue states, and trying to retain funding that's already been appropriated, such as our money for the Gateway Tunnel, which is relevant for the entire economy in the entire nation and the Eastern Seaboard, as well as not funding the Second Avenue subway. So these threats of withholding resources is illegal and inappropriate and unpresidential, and never been done before. So again, President Trump every day is breaking laws, breaking norms, creating chaos, showing he's corrupt, self-dealing, lining his own pocket, rewarding his billionaire buddies, all while he's cutting health care to millions of Americans.
Thank you, Senator.
Senator Gillibrand, Sarah Darmanian from News Channel 13 in Albany. I have two questions for you. One is about the TSA and FFA. What are you hearing in terms of employees either calling out or showing up to work? And then the second part is if you go to the U.S. Treasury website, there's a notice there that says the radical left has chosen to shut down the United States government in the name of reckless spending and obstructionism. As a result, the U.S. Department of Treasury's website will only be sporadically updated until this shutdown concludes. I'm just wondering if I can get your reaction to that.
It sounds like they're playing politics with people's health care, and it's an outrage, and it's absurd, and it's wrong, morally wrong. And so I just disagree with the politics that they are playing with people's lives and people's safety.
And do you have any update on FFA or TSA employees or regarding the shutdown and they're not being paid?
Well, the transportation secretary has said that he will ensure the safety of all flights during a shutdown. However, if the government shutdown continues into next week, the air traffic controllers will miss a paycheck. And as we saw at the Burbank airport earlier this week, it's possible that we may not have enough controllers at airports to operate flights. I am ranking member on the Transportation Appropriations Subcommittee, so I'm very attuned to the impact this shutdown will have on our air traffic controllers and flights. I worked this summer with my Republican counterpart to make sure that our appropriations bill fully funded the air traffic controllers to help modernize their system. So this is exactly what we need to do, again, to get Democrats and Republicans to come together to negotiate healthcare so we can make sure our transportation is safe and that our flying public is safe.
Thank you, Senator.
So for people who represent the North Country on this call, the Transportation Secretary has said that they won't be able to have funding to pay airlines for essential air service subsidies. So just like every other government shutdown, the federal government will fully compensate the airlines for essential air services. American Airlines has already said that they will not change any of the services to Watertown. Other EAS airports include Messina, Ogdensburg, Plattsburgh, and Saranac Lake. So if you have a flight to one of these airports, please check with your airlines to make sure it's still going.
Just curious, Senator, have you heard anything from the southern tier, like Jamestown and places like that? I don't know if you're hearing anything because they have some small airline services down there.
Not yet. I've not heard of any disruption, but we're obviously calling the airports and talking to constituents every day about what's happening. Any other questions?
Senator Terry Frank in Jamestown again.
Hi, Terry.
Just for Ron's information, there is no EAS in Chautauqua County, not at Dunkirk nor Jamestown.
Okay.
Yeah, okay.
I have to go vote. Thank you guys for being on the phone. I'll see you soon. Take care.
I pulled a Republican aside on the floor and I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera, just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like most like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts. I was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.
And on behalf of all of the Niagara County Legislature, I am honored to be here today to join the Senator in a very important announcement. Let me start by saying that no community loves their air base more than Niagara County loves the Niagara Falls Air Reserve Station. For well over 2 decades, we have been doing all that we can to protect this space that we can view as the integral part of this community. Much of the work that has been done by NIMAC, and we are very thankful for all the dedication and the volunteers who have helped promote this space right here at home and also in Washington. One of the best ways to secure a continued future is to ensure that the continuity receive funding to upgrade and expand the facility in support of the professionals. That is why today's announcement is so exciting, and we thank Senator Joe Brand for being here today. As a veteran myself, I am proud that our community is home of this military installation and the men and women who are part of it. We thank all of them for the dedicated service for our country and for our community. We will continue to do all that we can to ensure that the Niagara Falls Air Reserve Station is here for one long, long time. Senator, thank you for coming.
Thank you, Legislator. Good morning, everybody. It's an honor to be here at the Niagara Falls Air Reserve Station. I just want to start with offering my condolences to those impacted by the devastating bus crash that occurred near this community a little over a week ago. My heart breaks for the 5 individuals who lost their lives as a result of this tragedy. Their loss is felt deeply in our state, and I'm keeping their friends, family, and loved ones in my prayers, as many are still recovering from the devastating injuries sustained in the automation would improve command and control operations, streamline communications, increase mission responsiveness, and training. What's more, all of this will be in compliance with base architectural and energy standards. Truly a win-win for everyone. Funding was included in the appropriations bill based on the Senate with bipartisan support earlier this summer. As the bill awaits further deliberation in the House of Representatives, I am committed to continue to fight for this funding so that the Niagara Falls Air Reserve Station can get the new facility it needs to fulfill its defense mission. I'm happy to take questions. And now I'd like to introduce Michael Zimmerman, our chairman of NIMA.
Good morning, everyone. It's a privilege to stand here alongside Senator Jim Brown. Thank you for your steadfast support for the combined operations of our facility at the Niagara Falls Air Reserve Station. This facility is critical to ensuring the readiness and operational excellence of the 914th Air Refueling Wing, supporting both our nation's defense and the regional economy. We also want to extend our sincere thanks to Senator Schumer and Congressman Kennedy for their continued advocacy and commitment to the Niagara Falls Air Reserve Station. The combined support of our federal delegation brings us closer to securing the funding necessary to move this project forward. With their support, we can ensure that Niagara Falls Air Reserve Station remains a strong, sustainable, and resilient installation, one that continues to protect our nation while providing opportunities and economic growth for Western New York. Thank you for standing with us, and thank you for supporting our airmen and our community.
Any questions?
What do the $16 million go for? You said outdated buildings. Can you be more specific?
So I just had a tour of the home, and it's for a new building that will have combined operations and a command center, and that will consume the $16 million.
Do you see it hitting any snags in the house?
We're not sure whether President Trump wants an appropriations process, so that's the snag.
Senator, there has been some discussion about a new Homeland Security mission for this base. Apparently, there are active talks to try to get the Coast Guard to locate one of their helicopters, which are currently based in Detroit, out here. Have you heard anything about that, and would you actively support that idea?
I do actively support that idea. I think it's essential that we continue to bring more aircraft here on base so that it continues to grow in its mission to be able to serve our airmen and warfighters.
Similar to that, would this funding change the mission at all at the base, or would it be maintained with that refueling?
It would continue to be a maintenance base. I mean, we excel in preparing these aircraft for their missions, and we want to continue and augment that mission.
Have there also been any discussions about trying to lengthen the runway here? We've heard that come up. Actually, your predecessor talked about that. I was going to say your predecessor talked about trying to lengthen the runway here.
That's part of the priorities for funding for the base. We do have to extend taxiways as well as runways. The current aircraft, we can do the mission. We can't do the full mission that we're designed to do right now because of limitations of the aircraft taking off on the runway. They can't take off fully loaded with fuel, which is what they need to do currently as it stands now. So we're working towards funding for that as well. And that's, again, the COAF and the runway extension are critical to the mission, not just these are nice things to have. They are part of the mission of the 914th now. So they're essential to our moving forward.
Yeah, especially since they've got nuclear capability now, talking about the nuclear mission.
Yes.
That upgrades this base to some degree, doesn't it?
It does, yes. And the mission, and I just want to emphasize too the fact that we just made our conversion over the tankers in 2017. So the process they've gone through is just incredible. They are where they are now, at the top of their game, doing the mission.